How should the federal government support those suffering from opioid addiction?
Well, we need to destigmatize addiction, and we need to provide people mental health when they need it. We need to provide people pain medication when they need it, but in a way that actually helps them and doesn't harm them. And we know that there are people who have chronic illness and they need to have access to opioids. Now, the problem with the opioid epidemic is not the drug itself. The problem is the other elements that are lacking in such environments. Access to employment, making sure that people have access to to economic opportunity, to thriving in their lives and in their families, and where they can actually seek care when they fall into addiction, and even before falling into addiction, making sure that we have a preventative healthcare system that helps people prevent going deeply into addiction. So I support safe injection sites that are monitored, so that we can at least start to get people off the streets and into a care system that can help them get healthier.
Well, the opioid epidemic has devastated communities across the country, and our district is no exception. Here in Massachusetts, we've had one of the highest rates of opioid-related deaths, and we have not made enough progress in reversing this trend. I think that we need to realign our priorities to focus on prevention, treatment, and recovery. As a member of Congress, I will be determined to hold Big Pharma accountable for their role in this crisis and to ensure that access to treatment is more readily available in every community. I also strongly support the CARE Act, which would disperse $100 billion in federal funds to provide much needed resources for state and local governments to expand their capacity to treat opioid addiction. And I think that we can't have any illusions that we can solve this crisis without addressing the underlying issues that drive so many to addiction and stand in the way of recovery, including poverty, the absence of opportunity, and lack of access to affordable housing and healthcare.
Well, for starters, it should be possible to get drugs to treat your opioid addiction without having to go to a street dealer. I think all drugs should be crime-free. I mean, maybe you would have to go to a rehab or something like that to get your to get what you're addicted to, but criminalizing it is just the wrong way to go.
About 5 years ago, I was a Marine reconnaissance platoon commander in Panama, and I commanded a platoon working with Colombian Special Operations and Panamanian Public Forces to interdict drugs that were coming up from South America to the United States. This is an issue I've seen firsthand. I've seen the violence and the poverty it engenders, and I've seen, of course, here in Massachusetts, the havoc that it wreaks on families and young people. We need to have a more expansive recovery program for those who are addicted to opioids. That means both funding as well as literally the number of beds available in facilities, which has been a major constraint. And we need to remove the stigma from raising your hand and saying, I've got a problem. And that comes from elected officials being willing to stand up and stand with those who are afflicted by opioid addiction.
So the opioid crisis continues, and I'm actually a little bit afraid that it will be a little bit under the radar given the crisis that we're dealing with now in healthcare. It continues, and it must be addressed. And I think that it's important for us to ensure that there is investment in community-based health centers, and that we look at the whole support system that is needed to help our fellow citizens who are addicted to opioids. And that means ensuring that they have the right insurance, ensuring that they have support around their other medical needs, ensure that they have appropriate housing so that they have the environment to actually become healthier. I think the federal government can be involved in this in terms of ensuring that insurance coverage is appropriate and effective for people who are addicted to opioids. I think the federal government can also support grants for these community-based services, and even as necessary, other forms of financial assistance.
So the opioid overdose crisis is something I have worked on, both as a researcher and also someone who worked at the New York City Health Department. It has been going on for decades, but it has been exacerbated because of pharmaceuticals, because of the misuse of opioids, because of fentanyl in our communities. There is a lot that can be done at various levels. Better treatment, better access to treatment, ensuring that naloxone is available to people to reverse overdoses in the streets, that children don't have to worry about being separated from their parents because they are trying to get over a disease. I think the most important thing is, and it has been happening, is a shift from criminalized substance misuse to recognizing that this is a disease, and also shifting the blame from the individuals to the corporations, to the pharmaceutical companies, to those who knew that they were peddling something that was addictive and doing it in a way that has harmed our communities. So what needs to be done at the federal level? More investment in community responses, more investment in treatment, more investment in public information to reduce stigma around opioids, and then really reaching out at a time like today where COVID and the social isolation that we're all experiencing. I worry that we're going to see a surge again in substance use and misuse. So recognizing that these issues are interconnected. Who uses and who dies from opioids is our members of our families, our neighbors, our friends. It's not someone without a face. So let's talk about it. Let's open up about our problems with addiction, and let's expect that the government and the corporations pay and provide the resources for a sustainable solution to this problem.
This is such a fundamental and existential crisis, especially in the Massachusetts 4th District. And we need to take a comprehensive, holistic approach to attacking it. We need to have massive federal investment into this issue. We need to make sure we have community care centers. And in the short term, we have safe ejection sites. But the holistic approach means we have to work on housing for those that have a substance use disorder. And we need to work on transportation. We also have to decriminalize those who are in poverty, those who have substance use disorder, and those that have mental health. A lot of these things are all interconnected. And one of the ways that you do that is you destigmatize mental health and substance use disorder. You make sure that insurance companies can't discriminate against those seeking mental health care and care for substance use disorder, and that we increase mental health care access in our healthcare system. These are all really important, but it really starts with making sure we're educating our youth about substance use disorder. We need to do a far better job. We need to engage the community, and we need to educate the community starting at the earliest ages, so it's not too late once they are already addicted to opioids.
Yeah, this is something I worked on a lot when I was Maura Healey's Attorney General Maura Healey's senior advisor and assistant attorney general. When I was there, we sued Purdue Pharma and the Sackler family, and we put them out of business for making a drug called OxyContin. I'm sure you know about that. Look, here's the fact. There are 5 people today in Massachusetts who will probably die because of an opioid overdose, just as there were 5 people who died yesterday and 5 people who will die tomorrow and the day after that and the day after that. Let alone tens of thousands more who are trapped in these cycles of addiction. And these are tragedies. Every single one of these stories is a tragedy. It's a family that has an empty seat at the dinner table. It's a family that doesn't know where their child is or how to help them. It's a grandparent that's now raising a grandchild. It's heartbreaking. And in my work with these families, in my work with, in Taunton with Joanne Peterson at Learn to Cope, or Corey Palazzi, a young man who was paralyzed from an opioid overdose that he got as a result of an addiction that developed because he was an athlete, and he had shoulder surgery, and he got prescribed too many pills, and one thing led to another, and he is now paralyzed from the neck down, and a motivational speaker going from school to school to talk to young people about the dangers of these pills. So this is one of the reasons I ran for this seat back in the fall, is because these families have been promised help and assistance by people, including President Trump, that has never been delivered. They just have been forgotten. And so they need a few things. The first is they need the actual resources and treatment that they have been promised. We need to get that to them. We need prevention education for young people. There is no statewide prevention program in Massachusetts, let alone in the country. We started the first one in the Attorney General's office when I was there, which was great, but it was just in 300 middle schools, and it was just a grant funded by the GE Foundation. We need a more substantive federal program here that's evidence-based. We need to make sure that first responders have the resources they need to save lives. And we need to make sure that this never happens again. Purdue Pharma is not the last company that's going to realize they can make billions of dollars profiting off people's pain and sadness and anger and frustration. And, I'm worried about what will happen if we don't have more members of Congress for whom this is personal and who know this work and are ready to stand up to them and change the laws so that they can't just buy a couple members of Congress and do this all over again.
Well, again, this is a crisis. And as we build, one of my proposals is to have a public health corps in response to the COVID-19 crisis, have young people who spend a year in service. They can do contact tracing, they can expand public health, they can also work in the opioid crisis. In fact, there are AmeriCorps programs in Nashua, New Hampshire, in Gloucester, Massachusetts, and in Kentucky that are already doing this. We should expand that. We have to decriminalize this. We have to have needle exchanges. We have to treat mental health and take that out of the shadows and make sure that healthcare coverage covers it. We have to have a greater sense of urgency on the opioid crisis, and we also have to make sure that we're providing people with job opportunities. There's a lot we can do about this. We have to bring all of the providers together to make sure that we have a comprehensive strategy. If I'm elected, I will do that. It's a big issue in Fall River and in Taunton, parts of my district. It's a big issue where I was born, Katanning, Pennsylvania. So I'm familiar with this. And we have to make sure that we're not criminalizing people, but instead giving them the support they need.
Yeah. Well, here's another reason to support Medicare for All, right? Because it funds coverage for mental health care and for coverage for addiction. The federal government needs to make sure that we have funding for beds so that people who need treatment short and long term have access to the care that they need, and their families have that assurance. We need to hold pharmaceutical companies that got us here, those companies that were the bad actors, we have to hold them accountable for this crisis. We need to end the stigma around mental health and particularly around addiction treatment. And we need to make sure that we're funding medication-assisted treatment programs so that people can access the care that we need. And for community organizations and for families and individuals that need access to naloxone, we have to make sure that that vital resource is available to anybody who needs it or may need it to assist a loved one.
So we have a amazing campaign staff of 30 volunteer staffers, young adults who strongly believe in our campaign mission. And one of our staffers is named Jade, and her brother died from an opioid crisis, and that's part of the reason why she's drawn to our campaign, because she understands as well as I do that there's really two elements to this. Again, it's the people and the system. She understands that early childhood really sets people on a path of either success or failure. And that's a binary. I know it's not quite as divided as that, but if you have parents who don't have the support that they need to create stable homes, if they don't have the resources to be able to pay their bills, if they don't have the resources to have paid family leave, they're significantly more likely to be emotionally stressed and take that stress out on their children. So that's one issue, is that we need to make sure American families have progressive policies to support their children and their families. The second issue is really, frankly, the system issue, which comes down to we have made huge progress in terms of the opioid crisis when it comes to prescription drugs. That significantly has improved over the last couple of years, but we still have a huge flood of fentanyl coming in from China, which has been intentionally designed by the Chinese government to sabotage American success. And so the problem is that we don't put enough money as a country into screening imports from overseas. It's a ratio of like 800 crates to one individual to scan these crates, and that's like on a daily basis. And it's just not conceivable, and so we need to put more resources into ensuring that our imports and exports have greater facilities to screen drug transportation across country borders.